If you're living with a chronic condition, or you love someone who is, then this video might be one of the most important ones you watch this year. And before we get into everything, do me a quick favor. Comment your name and state below. I'd love to see who's watching and benefiting from these videos. You'd be amazed how many people find someone from their own state in the comments and start talking about their Medicare experience. It helps more than you think. So let's jump in, because chronic illnesses aren't light topics. Whether it's diabetes, congestive heart failure, COPD, kidney disease, or one of the other conditions millions of Americans are living with every single day, one thing is consistent: the cost of care adds up fast. The doctor visits, the specialists, the medications, the tests, the monitoring. It becomes a cycle that feels never-ending, and for many people it gets overwhelming, not just medically, but financially. And that's exactly the reason chronic special needs plans, C-SNPs, exist in Medicare. Yet almost nobody knows about them. They'll hear Medicare Advantage, they'll hear Part C, but these specialized plans? Completely under the radar. Even though they're available in more counties every year, and in 2026 they're expanding even more, especially with dental benefits and chronic-focused supplemental coverage. The first time I ever helped someone enroll in a chronic special needs plan, it was a gentleman named Richard from Arizona. He had been living with diabetes for 17 years. When we looked at his current Medicare Advantage plan, he was paying a $45 specialist copay every time he saw his endocrinologist, twice a month. His insulin was capped, yes, but some of his other medications were on higher tiers. And his plan didn't have the kind of disease management support he needed. His wife was exhausted trying to keep everything organized: refills, glucose monitoring supplies, scheduling appointments, remembering all the new instructions from different doctors. You could hear the stress in her voice when she talked. When he switched into a diabetes-specific C-SNP, the change was immediate. His specialist copay dropped to zero. His diabetic medications moved to lower tiers. They assigned him a care coordinator who literally handled everything from checking if his prescriptions arrived on time to making sure he never missed lab appointments. But here was the biggest relief for him: he stopped feeling like he was managing diabetes alone. That's why these plans matter. C-SNPs exist for people who have specific, documented chronic conditions approved by CMS. There are 15 CMS categories, things like diabetes, chronic heart failure, COPD and chronic lung disorders, HIV, AIDS, neurological disorders, cancers, autoimmune diseases, even serious mental health conditions. But in most areas, the most commonly offered C-SNPs are for diabetes, cardiovascular disorders, chronic lung issues like COPD, end-stage renal disease, and sometimes cancer. And because these plans are Medicare Advantage plans, you must still be enrolled in Medicare Part A and Part B. That part doesn't change. What does change is how your care is coordinated, and how your costs are managed. One thing people love about these plans is that there's no traditional Medicare Advantage enrollment period locking you in. As long as you have the documented diagnosis, a C-SNP gives you a special enrollment period. You can enroll any time during the year. It doesn't matter whether you were diagnosed last week or 10 years ago. The only requirement is written proof from your treating physician that you have that condition. That's it. Then the plan will verify it within 60 days. If it's not verified, they'll move you back to a regular Medicare Advantage plan, but if the doctor submits it correctly, you're good. But let's break down why people even choose these plans. Because it's not just the cost, though lowering costs is a big part of it. It's also the way the care is designed. Imagine someone who's living with COPD. Breathing becomes a daily challenge. Flare-ups happen out of nowhere. Small colds turn into major complications. Those people need frequent pulmonary check-ins, rescue medications, inhalers, sometimes oxygen equipment, and coordination between multiple specialists. A regular Medicare Advantage plan treats them the same as everyone else. But a C-SNP for COPD is built around that disease. They give the member a care team that understands pulmonary disease. The care coordinator checks in regularly. And if a patient is trending downward, they intervene faster so it doesn't turn into a hospitalization. Insurance companies know it's cheaper to keep someone stable than to pay for a 5-night stay in the hospital, so they invest in proactive care. For diabetes, the same logic applies. A C-SNP may include diabetic educators, nutritional counseling, podiatry benefits, retinal screenings, and sometimes lower costs for continuous glucose monitors or supplies. In a world where diabetes affects over 38 million Americans, that level of support becomes life-changing. And yes, insulin is capped at $35 under Part D nationwide, but the rest of the diabetes medications? The testing supplies? The continuous monitoring equipment? Those aren't capped, and that's where C-SNPs come in with richer, disease-specific formularies. Heart failure is another big one. Someone with congestive heart failure might have 6, 7, 8 different medications they're juggling. A C-SNP for cardiovascular disorders often puts many of those common drugs into lower tiers or gives reduced copays. And more importantly, the care team is tracking whether the patient is having swelling, fatigue, shortness of breath, weight gain, warning signs that they might be headed for an ER visit. Their coordinator is trained to catch that early. But let's touch on something new and important: 2026 updates, especially around dental coverage in Medicare Advantage. The entire Medicare Advantage market is shifting in 2026, but one of the biggest enhancements in C-SNPs specifically is the improved supplemental dental benefits for chronic condition members. In many counties, plans are offering richer dental allowances or expanded dental networks for people enrolled in chronic special needs plans. Carriers have realized that oral health is directly tied to chronic disease outcomes, especially diabetes and heart disease. Poor dental health increases inflammation, worsens glycemic control, and raises cardiovascular risk. So insurers are now offering more preventive cleanings, better coverage for periodontal services, and in some counties, higher allowances for major dental work. This is all part of the 2026 push to improve health outcomes by addressing root causes. Now, you may be wondering, how does a care coordinator actually help day to day? Let me walk you through a real scenario. A woman named Linda in Ohio had a heart failure C-SNP. Her care coordinator would call every few weeks. One day, Linda mentioned she'd gained 4 pounds in the last 2 days and thought it was just from drinking more water. But the care coordinator recognized the pattern instantly. Rapid weight gain can indicate fluid retention, which is dangerous for heart failure patients. She arranged a same-day appointment with Linda's cardiologist, helped set up transportation, and sure enough, her medication needed to be adjusted. That early intervention prevented a hospital stay that could have cost thousands of dollars and caused a major setback in her health. That's the kind of real-time support C-SNP members get, the kind you simply don't get with a standard Medicare Advantage plan. And that's something people don't realize: C-SNP plans don't just save money. They help you live better. They remove barriers. They help you breathe easier, sometimes literally. Now let's talk cost differences more clearly. In a standard Medicare Advantage plan, specialist copays usually fall around $30 to $50 per visit. But if you're someone dealing with a chronic illness, you may need to see multiple specialists: a cardiologist, an endocrinologist, a nephrologist, a pulmonologist, sometimes every month. That adds up fast. Many C-SNPs have drastically reduced copays for specialists, and some have $0 specialist visits altogether. That alone can save someone hundreds or thousands of dollars a year. Then you have the medications. If a regular Medicare Advantage plan places your chronic-related drugs in Tier 3 or Tier 4, the cost can be significant. C-SNP plans often restructure their formularies so the most essential drugs for that disease are placed in lower tiers or given preferred pricing. For someone on heart medications or advanced diabetes medications, that makes a major difference. There's also the network flexibility. Some C-SNP plans, especially the HMO types, waive referrals to specialists even though regular HMO plans require them. When you live with a chronic illness, waiting on referrals slows everything down, and skipping them helps people get faster care. Another difference is how these plans coordinate supplemental benefits. Transportation, nutritional counseling, over-the-counter allowances, and disease-specific items like diabetic shoes or pulmonary equipment are often better structured for people in a C-SNP. And in 2026, more carriers are adding technology benefits like remote monitoring, virtual check-ins, and enhanced telehealth for chronic condition members. So how do you know if you qualify? First, you must meet Medicare eligibility requirements, being 65 or older, or disabled for 24 months, or having conditions like ALS or ESRD that grant automatic Medicare eligibility. Second, you must have a documented diagnosis of one of the qualifying chronic conditions. That's the part people get confused about. You don't need a fresh diagnosis. You don't need a diagnosis from a certain type of doctor. You simply need written proof from a legitimate treating physician. That's all the plan requires. If the plan you're applying for is a diabetes C-SNP, your doctor must confirm diabetes. If it's a heart failure plan, they must confirm chronic heart failure. And so on. Once you enroll, the plan sends a form to your doctor, and you have 60 days for them to verify it. It's a simple process, but you'd be surprised how many people don't realize they're eligible for these plans when they've had the diagnosis for years. And maybe you're wondering, why would insurance companies offer richer benefits? It's simple: chronic illnesses are expensive. Hospitalizations are expensive. Complications are expensive. But prevention costs far less. Insurance companies know that giving a member a care coordinator, lowering drug costs, helping them stay ahead of flare-ups, and improving medication adherence all result in fewer hospital visits. And fewer hospital visits mean lower costs for the insurer. It's a win-win. I always tell people, if you're living with a chronic illness, you deserve a plan that understands your condition. And these C-SNP plans do exactly that. They're built for you, not for the general population. They speak your language, they know your struggles, and they structure your coverage around what you need most. Now imagine this: you or someone you love wakes up tomorrow knowing that navigating their illness isn't entirely on their shoulders anymore. They have someone checking in. They have lower co-pays. Their medications are more affordable. They have better dental coverage in 2026 because carriers now understand how oral health impacts chronic disease. They have support. They have structure. They have someone in their corner reminding them that they don't have to do this alone. That's the difference a C-SNP makes. So if you're dealing with diabetes, heart disease, COPD, kidney issues, or any chronic condition that's on the CMS list, it's worth at least taking the time to look into whether one of these plans is available in your county. If it is, compare the benefits. Look at the specialist co-pays. Look at the drug tiers. Look at the dental coverage. Look at whether the care coordinator is included. You'll often find that these plans aren't just an improvement, they're a lifeline. And if you ever want help understanding which C-SNPs are available near you, or what your doctors and medications look like on each plan, you can always reach out to a licensed broker who understands these plans. They can walk you through everything, compare plans across carriers, and help you find the one that matches your condition best. Because living with a chronic illness is hard enough. Medicare shouldn't make it harder. And these plans, these chronic special needs plans, exist to make something in your life just a little bit easier. And sometimes, that little bit easier becomes a huge difference in your health and your wallet. And once again, before you go, drop your name and state in the comments. You have no idea how many people you help just by connecting. And if you found this video helpful, give it a like so it reaches more people who desperately need this information.